Hi, this is Loralee Kapp, a Solutions Manager with Managed Outsource Solutions. Today I want to talk to you about the dermatology billing practice trends and what to watch for. For a full list of ICD-10 codes associated with this podcast, please see the attached document. To ensure accurate and timely claim submission, it is important to stay up to date with the industry's developments and dermatology medical billing trends. The healthcare industry is in a continual state of flux, driven by shifts in scientific advancements, patient privacy, and insurance providers' policies. This has also impacted medical coding and billing, with rules changing periodically and new codes being introduced every now and then. To stay ahead of the curve, physician practices and providers of medical billing services in the U.S. must stay up to date with the current trends. Adapting to changes with the help of a reliable medical billing and coding service will ensure efficient claim submission for timely and accurate reimbursement. Though all areas of healthcare face denials and audits, these concerns are more common in dermatology. Dermatology billing and coding requires thorough reporting, detailed information on procedures completed, and must follow multiple procedure rules, which can lead to billing and coding errors. Staying abreast on the latest trends, such as changing codes, billing rules, documentation requirements, and payment methods, is crucial for success with dermatology medical billing. Now let's check out the 3 top dermatology billing trends that medical practices need to pay attention to. COVID-19 related skin conditions. A wide spectrum of skin conditions has been reported in association with coronavirus. At the American Academy of Dermatology annual meeting held virtually in April of 2021, the most discussed topics were COVID-19's effect on the skin and coverage for vitiligo and atopic dermatitis treatments. A poster presented at the AAD-VMX 2021 highlighted skin issues due to mask wearing, such as acne, erythema, and rhytides. Dermatologists need to ensure that these conditions are reported using the correct ICD-10 codes. Dermatologists have an important role in the management of infectious disease outbreaks like COVID-19. In the coming year and beyond, they should stay focused on their important role in such healthcare crisis and consider how they can best diagnose and effectively treat new skin manifestations while ensuring the highest quality for all patients who need dermatologic care. Telehealth dermatology appointments are gaining popularity. Before the pandemic, telemedicine use in dermatology was minimal. In June 2020, the National Psoriasis Foundation's COVID-19 Task Force founded a new list of recommendations for patients and practitioners on telehealth usage. According to the study, candidates for telehealth are clinically stable patients on treatment, those requiring follow-up care or prescription refills, and those with COVID-19 who are experiencing flares. It was also recommended that new patient telehealth consultations should be restricted to only those facing significant barriers to in-person care. In-person visits should also be provided for patients experiencing disease progression. Patients have also been upbeat about remote office visits. An UpDocs survey found that 65% of patients who use telehealth services liked the convenience, and 63% appreciated not being exposed to other sick patients, while 44% favored the ease of scheduling appointments, and 38% noted the simplicity of scheduling follow-up appointments. These statistics provide evidence of telehealth technology's versatility and accessibility. According to a study presented at the annual AAD conference, nearly 67% of people plan to utilize teledermatology appointment options post-pandemic, even after clinics are allowed to do in-person visits. Going forward, videos, photos, and patient-reported data are likely to be the basis of telehealth in dermatology settings. Dermatologists also need to know the rules of coding and billing telehealth visits. Outsourcing your dermatology medical billing services to a reliable partner can help your practice in many ways. Dermatology practices are under added pressure to cut overhead costs in these challenging times. They also have to deal with coding and billing changes that happen from time to time and maintain compliance with standards. Outsourcing is a great option to gain time to focus on changing demands in dermatology care. Partnering with a reliable provider of dermatology medical billing services can help practices streamline operations, cut costs, and ensure proper coding and billing. To secure optimal payment for services rendered. Though dermatologists provide many types of medical, surgical, and cosmetic surgeries and services, getting reimbursed appropriately can be a challenge. In Medscape's 2019 Dermatologist Compensation Survey, respondents cited getting fair reimbursement and following multiple rules and regulations as the most challenging part of their job. Compared with 38% of all physicians, 46% of dermatologists reported spending 10 to 19 hours a week on paperwork and administrative tasks. These findings suggest that partnering with a professional dermatology medical billing and coding company is the best option for practices to translate patient services into error-free claims, get appropriate reimbursement, and improve their bottom line.